South African President Cyril Ramaphosa has reimposed a ban on alcohol sales and ordered the closure of all bars as part of new restrictions to contain a resurgence of the coronavirus, including a new variant. He also announced an extension of the nighttime curfew from 9 p.m. until 6 a.m. Ramaphosa said reckless behavior contributed to the recent spike and is putting pressure on hospital emergency units. He said the new restrictions would be reviewed in a few weeks' time. Well, for more now, we're joined from Cape Town by DW correspondent Adrian Creech. Adrian, fill us in on just how severe the pandemic is in South Africa right now.
We're currently in Khayelitsha at a hospital that's the biggest township here in Cape Town, and just one health worker told us the house is on fire. That is how bad it is, or how bad it has been over the past weeks, because the numbers have been steadily increasing. We don't know by what amount at the moment, because testing hasn't been done properly throughout the festive season. Most likely the next days we will see the extent, but the worst is also still yet to come, because during the Christmas festivities, traveling was allowed. People were allowed to have private meetings with their friends and family, and many epidemiologists and also health workers here are fearing that this will mean a further increase of cases in the next 2 to 3 weeks, and possible the next peak that will be coming then. But people here, the health workers, are quite relieved about the measures that were imposed by the president yesterday. One in particular, the ban of alcohol, because they hope that this will decrease the number of other cases coming here to the hospital. Remember, this is the third alcohol ban we've seen in South Africa. During the first two bans, we have seen it clearly that the number of trauma admissions went drastically down, and that is also the target here now, that these numbers will go down so the health workers have time to focus on COVID-related issues.
A new variant of the coronavirus has been detected in South Africa. Tell us more about that.
We still know quite little about the new variant. What we do know is first research suggests that it's more contagious and that it has been spreading rapidly in hotspots areas here. It means that it's already the dominant variant that is persistent in South Africa at the moment, but still a lot of more research needs to be done. But what is clear now, the second wave is definitely here. That's what epidemiologists say, and you can also feel it from friends and family. There are more and more cases that you hear about. I talked to a friend recently. He got COVID 3 weeks ago because he went to a barbecue with 12 friends. 11 of them got the virus after the barbecue. So this is another anecdotal evidence for the more contagious variants. But as I said, more research needs to be done to fully understand what is happening, and also to see if it's really more deadly, because at the moment it doesn't seem to be that case.
How well prepared is the healthcare system there, Adrian, to deal with this new surge?
It's going to be definitely a challenge, because we're already seeing now that not enough preparation was done between the first wave and the second wave that we're experiencing now. There are already cases, not here in Cape Town, but outside Cape Town in some hotspot areas, that hospitals are full, especially ICU beds are not available anymore. Patients have to be transferred. And this is what they are expecting here in Cape Town as well in the next week, that there will be a challenge in finding ICU beds. And that will mean for health workers, they have to prioritize. They have to make decisions who will get an ICU bed, who will get on oxygen, for example. This might be the scenario, but again, we still don't know what's really happening. Also, during the first wave, remember, in South Africa, everybody thought it's going to be very bad. In the end, it wasn't that bad. So there is still some sense of optimism. But what we have to understand here in the end is also that this thing here will take quite some time. South Africa will not get a massive amount of vaccines next year. The president announced in the first quarter, on the second quarter of next year, first arrival of vaccines. Maybe up to 10% of people here will be able to access it, but definitely not enough to reach herd immunity. So that the country will most likely face a third and a fourth wave in the next year.
Adrian, good to see you. Correspondent Adrian Creech there in Cape Town.